I'm Stacey Galandi, and this is Deluxe Version Magazine. My guests today, right on the couch, Dr. Hayley Brown and Dr. Steve Brown. Welcome.
Thank you for having us today.
Thanks. Now, I've noticed that the two of you both have the same last name. Not a coincidence, right? You're not only married, but you are in practice together. Is that what makes Desert Hills Plastic Surgery Center so special?
Yeah, I think so. I mean, we both bring a different aspect to the facility. Dr. Brown really is the head of the Desert Hills Plastic Surgery Center. She's the plastic surgeon, runs the office day to day, and I'm there to help out if things need to be done in the office. But, really I'm her personal anesthesiologist and help take care of her patients. And we work as a team, medical, surgical, anesthetic team. So.
Is this something that's very unique in terms of this kind of relationship, being married and also working together too?
Yeah, it is to be able to work together and then come home together and be a family. And it is a special practice. There's not a lot of husband and wife teams that are able to do surgery and provide plastic surgery services and provide care, not only just from a surgical standpoint, but from an aesthetic standpoint. And the nice thing about having Steve around is that, I know the patients are safe. I know who's showing up to do the case, and he knows my routines, and he knows the patients, and he's able to meet with them before, during, and afterwards if there's any concerns or questions, which a lot of patients have fear of anesthesia and fear of going under. And it's nice to be able to just have someone available who can make them feel comfortable and go over their medical history and answer any questions or concerns that they have about anesthesia. Where ordinarily when you go to a plastic surgeon, a lot of the anesthetic isn't really discussed, and the patients aren't very familiar as to who's coming that day to do the anesthesia. They have no interaction with them ahead of time. So I think it gives the patients, a sense of comfort, and definitely they feel safe in our hands, which is just nice to be able to offer that.
How is it for you? Because obviously it's a benefit for the patients, for your clientele. What do you think let me do that again, sorry. For you guys, obviously this arrangement works really well for your clients, your patients. How is it though, working as husband and wife, but also balancing it, home life and work life? Is it tough?
No,
Too much together?
No, it's actually very easy.
It's very easy.
Throughout my life, my father's a physician, a surgeon. My father-in-law's a surgeon. So I've worked with family members throughout my life. And when I get into the OR, really, it's like a switch. It's just like working with any other surgeon in Las Vegas or any other part of the country that I've worked. I'm busy doing my job, taking care of the patient, making sure they're safe, wake up not nauseated, not in pain. I'm really not focused on our home life or what have you.
You're able to keep that at home.
Keep it separate. There's a curtain that divides us both. So I'm doing my job separate. He's doing his job, but yet we have the communication to discuss at all times, how is the patient doing? What kind of position do we need on the table? And I feel comfortable. I feel comfortable knowing that I trust him, and he's got the patients taken care of, and we communicate really, really well. So
we really don't do a lot of discussion for that because I know her routine.
Yeah, he knows the routine. I don't have to say anything.
Yes.
Like I'm so confident, I don't have to worry about those things, that I know my patient is safe. Which is just it feels good to not have to worry as much,
Exactly. It's one less thing to have to.
And it's the same thing. Sometimes things happen in the anesthesia, whether it's blood pressure, heart rate, and she knows when I'm busy back there doing what I need to do to make sure
just
the patient
his
gets
sounds.
access.
I know. I know what's happening based on his sounds alone.
Any of those sounds you want to share with us?
I hear him. I know his footsteps. So it's cool to have that vibe about what's going on,
Well, you guys have been almost working together for 20 years, so you think that this is a partnership that will continue for many years to come?
Yeah, absolutely. I would hope so. I wouldn't want to practice any other way. It feels comfortable, and it's It's relaxing. It's fun. We have a great time together. And then, we're excited to go home too, and then be a family and spend time with our kids and go through all that chaos as well. And it's a great balance.
Fantastic.
Yeah.
Well, Dr. Hayley Brown, Dr. Steve Brown, thank you so much for joining us today. If you want to know more about these wonderful doctors and also the Desert Hills Plastic Surgery Center, be sure to pick up Deluxe Vision magazine.